I'm Dr. Jen Caudle. I'm a family physician and an associate professor at Rowan University. Now, we all have heard a lot of medical advice growing up, but today I'm going to answer some questions about what's true and what's not. These are the questions I get asked a lot. Are hydrogen peroxide and rubbing alcohol the best way to clean a wound? The answer, believe it or not, is no. Now, while both hydrogen peroxide and rubbing alcohol are antiseptics, which means that yes, they do kill germs, they can also harm surrounding tissue of the wound, and they can also destroy healthy cells. Guys, this is not good. It's actually one of the reasons why sometimes it burns when you apply them to wounds. But the bigger issue is that these can both delay healing of the wound, which is not what we want. You know, honestly, soap and water really is the best way to clean a wound. It'll wash out the debris and germs. Now, look, if you have stuff that's stuck in your wound, you can get a pair of tweezers to pull whatever is like any debris out that's in the wound, and then wash it with soap and water. Of course, you always want to talk to your doctor about what's best for your wound because every wound is created differently. Is gargling with salt water actually good for a sore throat? The answer is yes. The salt water actually helps decrease pain, reduce inflammation, and actually may help with some of the germs in the back of your throat. So you want to use warm water and mix 1/4 teaspoon of salt with a cup of water and gargle. Do you have to wait 30 minutes after eating to swim? The answer is probably not. You know, this idea goes as far back as 1908 when the Boy Scout handbook said that boys had to wait 90 minutes after eating to swim because of the risk of drowning. You know, when we eat, blood flow goes to our stomach and intestines to help us digest the food that we've eaten. And the theory was that there would be so much blood flow going to the intestines and the stomach that there wouldn't be enough blood flow going to the muscles. Now, it is true that when we eat, our blood flow does go to our intestines and our stomach, but it's not as though we don't have enough blood flow going to our extremities and limbs and other parts of our bodies to help keep us afloat. So therefore, we don't think you have to wait 30 minutes after eating to swim. Now, keep in mind though, it is possible that you might cramp up if you eat a big meal and then vigorously swim laps or something like that, so you may want to hold off on that. But if you're just planning to splash around, it's probably not a big deal. People always want to know if you should use a Q-tip for earwax. The answer is no. Q-tips can actually push wax further into your ear canal, which can cause impaction, discomfort, or even damage your eardrum, not to mention your canal. So what you can use instead is you can actually use some hydrogen peroxide. You can also get some mineral oil or glycerin to help soften the wax. There's a product called Debrox. I often recommend this to my patients to help soften the wax as well. There are also over-the-counter irrigation systems too that you can find at your local drugstore. You can also have your doctor remove it. This is something I do in the office. Remember, earwax is protective. It doesn't necessarily have to be removed at all unless it's causing problems. And for most people, actually, simply getting a wash towel, like this one, and wiping on the outside of the canal is sufficient to get rid of earwax. Now, we all know the expression, feed a cold, starve a fever, and people often ask me if that's true. So, is it? This phrase goes back a long ways. It's an old wives' tale that's been passed down for years. But you really shouldn't be starving anything. You know, when you're not well, make sure that you're getting proper nourishment and nutrition, and that you're staying hydrated as well. I recommend chicken noodle soup. It helps you stay hydrated. It's got a little salt to help keep fluids in. It's got veggies, lots of water. And then sometimes when people are nauseous or their stomach is upset, I often recommend the Brat diet, which is bananas, rice, applesauce, and toast. Sort of bland foods that will help you hopefully feel better and kind of calm your stomach. Does cracking knuckles actually cause arthritis? Well, the answer is cracking knuckles isn't a great habit, but it probably won't raise your risk for arthritis. That's the conclusion of several studies that have compared rates of hand arthritis among habitual knuckle crackers and people who don't crack their knuckles. When you crack your knuckles, what happens is the space between your joints and hands actually increases. Gas bubbles that are in those spaces actually pop or are crushed, and that's the sound you hear.